Hello, friends. What do you know about anemia? Over half of Indian women in the age group of 15 to 49 years are anemic. This is very important. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. Now we will discuss what is anemia. Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia, also referred to as low hemoglobin, can make you feel tired and weak. There are many forms of anemia, each with its own cause. The first picture is of anemia, and the second picture is normal blood. What are the causes of anemia? Anemia has three main causes. Number one is blood loss. Number two is lack of red blood cells production. And number three is high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods in women, pregnancy, ulcers in the GI tract, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid, or vitamin B12, blood disorders such as sickle cell anemia and thalassemia or cancer. Aplastic anemia, a condition that can be inherited or acquired. Glucose 6-phosphate dehydrogenase deficiency, a metabolic disorder. How common is anemia? Anemia affects more than 2 billion people globally, which is more than 30% of the total population. It is especially common in countries with few resources, but it also affects many people in the industrialized world. Within the US, anemia is the most common blood condition. An estimated 3 million Americans have the disorder. This is a slide of blood. Who is most likely to develop anemia? Anyone can develop anemia, although the following groups have a higher risk. Women, blood loss during monthly periods and childbirth can lead to anemia. This is especially true if you have heavy periods or a condition like fibroids. Children between the age of 1 to 2, the body needs more iron during growth spurts. Infants may get less iron when they are weaned from breast milk or formula to solid food. Iron from solid food is not as easily taken up by the body. And people over 65 years of age, people over 65 are more likely to have iron poor diets and certain chronic diseases. People on blood thinners. These medications include drugs, include aspirin, clopidogrel, Plavix, warfarin, Comodan, heparin products, epiexabin, Eliquis, Betrixaban, Bevixa, Dabigatran, Pradaxa, Idoxaban, Savisa, and Rivaroxaban Xarelto. What are the symptoms of anemia? The signs of anemia can be so mild that you might not even notice them. At a certain point, as your blood cells decrease, symptoms often develop. Depending on the cause of the anemia, symptoms may include dizziness, lightheadedness, or feeling like you are about to pass out, fast or unusual heartbeat, headache, pain including in your bones, chest, belly, and joints, problems with growth for children and teens, shortness of breath, skin that's pale or yellow, cold hands and feet, tiredness or weakness. How does anemia affect the body? Anemia can have other effects on your body in addition to feeling tired or cold. Other signs that you might be lacking in iron include having brittle or spoon-shaped nails and possible hair loss. You might find that your sense of taste has changed, or you might experience ringing in your ears. Different types of anemia may lead to other serious problems. People with sickle cell anemia often have heart and lung complications. If you have anemia that is not treated, it could lead to an arrhythmia, irregular heartbeat, an enlarged heart or heart failure. You are also at greater risk of getting infections and becoming depressed. You might have heard that iron deficiency is linked to chewing ice, which does happen. Chewing ice is a sign of pica, a condition that includes eating things that are not really food like chalk or dirt. So pica is also a sign of iron deficiency. It is often seen in children with anemia or ladies in their pregnancy. Diagnosis and tests: blood smear, blood tests, bone marrow, complete blood counts, ferritin blood test, heptoglobin blood test, iron tests, lactate dehydrogenase isoenzyme test, lactate dehydrogenase test, red blood cell indices, reticulocyte count, vitamin B tests. How does anemia affect pregnancy? Iron deficiency during pregnancy increases the chance of complications such as premature birth. After the birth, studies have indicated that babies born to women with low iron levels have a high risk of low birth weight and problems with their own iron levels. If you are pregnant, you are more likely to develop iron deficiency anemia. Your unborn baby relies on you for iron and other nutrients. Many women who are pregnant take iron pills to prevent anemia. To make sure that you have enough iron for you and your baby, eat well-balanced meals that include iron-rich foods and foods that provide B12 and B9 vitamins. Follow your healthcare provider instructions for taking vitamins and adding iron to your diet. Finding out that you have anemia is just the beginning. Finding the cause of the anemia will lead you to the best treatment. Does stress cause anemia? Sustained stress is another cause of anemia. Excessive stress hinders the manufacture of hydrochloric acid in your body, which is very important for the integration of iron and proteins. The deficiency of iron is equal to lack of hemoglobin and thus anemia. What causes iron deficiency anemia? You can get iron deficiency anemia from bleeding, either from losing a large amount of blood quickly, for instance, in a serious accident, or losing small amounts of blood over a long period of time. The body loses more iron with blood loss than it is able to replace with food. This can happen to women having heavy menstrual periods or in people who have inflammatory bowel disease. Not getting enough iron in the diet, needing more iron than you did previously, for instance, during pregnancy or illness. Pernicious anemia. In a strict sense, pernicious anemia happens when a person lacks something called intrinsic factor in the stomach, which lets them absorb vitamin B12. Without vitamin B12, the body cannot develop healthy red blood cells. Other types of anemia that involve lack of B vitamins, such as B9, that is folic acid, are also often lumped in as pernicious anemia. This name may refer to other conditions, including folic acid deficiency anemia and Addison's anemia, even though there is no intrinsic factor deficiency. Hemolytic anemia. This type of anemia can be caused by inherited or acquired diseases that cause the body to make deformed red blood cells that die off too quickly. An acquired disease is one that you didn't have when you were born. If it is not genetic, hemolytic anemia can be caused by harmful substances or reactions to certain drugs. Sickle cell anemia. This genetic form of anemia happens because the shape of the red blood cells is faulty. They are sickle shaped, which means that they can clog the blood vessels and cause damage. The hemoglobin does not work correctly. This type of anemia is most often, but not always, found in African Americans. This is the picture of sickle cell anemia. These are the sickle cells, these longer ones. These are the sickle cells, whereas these are the normal cells, normal red blood cells. Aplastic anemia. This is a type of anemia in that is caused by damaged bone marrow, which is unable to make enough red blood cells. It also may be congenital or acquired. Another name for aplastic anemia is bone marrow aplasia. That is a failure. Some people might think of this condition as cancer, but it is not. There is something referred to by some people as myelodysplastic anemia. However, myelodysplastic syndromes, MDS, refer to actual cancer and are a result of abnormal cells in the bone marrow. How do I manage anemia? While some types of anemia are short-term and mild, others can last throughout a lifetime. There are several ways to help manage anemia, including following a healthy diet, drinking enough water to stay hydrated, exercising regularly. However, if you have been weak, you should begin exercising cautiously. Check with your healthcare provider about ways to exercise safely. Avoiding exposure to chemicals that set off anemia. Washing your hands often to avoid infections. Taking good care of your teeth and going to the dentist regularly. Talking to your doctor about any changing symptoms. Keeping track of your symptoms by writing them down. Foods to be avoided. Some things have been shown to impair iron absorption. You should not take calcium and iron supplements at the same time. In addition, you may want to avoid or limit these items. Tannin-containing items like coffee, tea, and some spices. Milk, egg whites, fiber. You will not want to eliminate all fiber, though, because taking iron supplements could cause constipation. Soy protein. foods to be consumed. In general, you should eat iron-rich foods and foods that provide vitamin B12, B9, that's folic acid, and vitamin C. This means that you can enjoy plenty of good foods that is for you, whether you eat meat or not. You can get iron from plant sources like lentils, spinach, and pistachio. You can get iron from protein sources like lean beef and turkey. Whole grains and dark leafy vegetables are good sources of B vitamins. Some foods are even fortified with iron. Citrus fruits, berries, and other vitamin C containing foods like peppers and tomatoes improve iron consumption. It is a good idea to get advice from your healthcare provider or perhaps from a registered dietitian about the best ways to eat when you have anemia. Also, make sure that grapefruit does not interfere with any of your medications. How can I raise my iron levels quickly? Choose iron-rich foods: red meat, pork, and poultry, seafoods, beans, dark green leafy vegetables such as spinach, dried fruit such as raisins and apricots, iron fortified cereals, breads, and pastas, peas. What level of anemia is severe? Mild anemia corresponds to a level of hemoglobin concentration of 10 to 10.9 gram per deciliter for pregnant women and children under 5, 10 to 11.9 gram per deciliter for non-pregnant women. For all of the tested groups, moderate anemia corresponds to a level of 7 to 9.9 gram per deciliter, while severe anemia corresponds to a level less than 7 gram per deciliter. Foods rich in iron. If nutritional deficiencies are responsible for anemia, eating more iron-rich foods can help. The following foods are iron-fortified cereals and breads, leafy green vegetables such as kale, spinach, and watercress, pulses and beans, brown rice, white or red meats, nuts and seeds, fish, tofu, eggs, dried fruits, including apricots, raisins, and prunes. Risk factors for anemia. Anemia can occur in people of all ages, sexes, and ethnicities. The following factors increase the risk of developing a form of the condition: having been born prematurely, being between 6 months and 2 years old, menstruating in ladies, being pregnant and giving birth, having a diet low in vitamins, minerals, and iron, regularly taking medications that inflame the stomach lining, such as ibuprofen or other NSAIDs, having a family history of inherited anemia, such as sickle cell anemia or thalassemia, having an intestinal disorder that affects the absorption of nutrients, such as Crohn's disease, losing blood due to surgery or trauma, for example, having a chronic illness such as AIDS, diabetes, kidney disease, cancer, rheumatoid arthritis, heart failure, or liver disease. Summary: anemia occurs when a low number of RBCs are circulating in the body. This reduces the person's oxygen levels and can lead to symptoms such as fatigue, pale skin, chest pain, and breathlessness. There are 400 types of anemia. Common causes are blood loss, reduced or impaired RBC production, and the destruction of RBCs. The most common type is iron deficiency anemia. It sometimes develops due to a diet lacking in nutrients, Crohn's disease, or the use of certain medications. A doctor can use a CBC blood test to help detect anemia. Treatment varies depending on the type, but it may include iron or vitamin supplements, medications, blood transfusions, and bone marrow transplants. However, for some people with anemia, dietary changes can resolve the issue. That's all. Thank you very much.